For me, what it means to be recognized as a Castle County top doctor in 2024 is both an honor and encouragement to keep doing the work that I do every day, really to meet my patients where they are, to execute a value-based care model and keep our patients happy, healthy, and out of the hospital. For me, I initially decided to become a physician because I wanted to impact lives in a meaningful way with critical conversations, but not just that, really to have a long term relationship with patients to make those decisions that are important for their health, really to take a healthcare journey with them over 10, 20, 30 years to make sure that they're living happy lives where they're getting the most out of their health and out of their relationships. When a patient comes into our office from check-in to check-out, they can expect a hands-on experience from where our welcome coordinators, medical assistants, our clinical scribes, our social work team, and our behavioral health team are expecting them. They know about them. We spend time each day really to discuss our patients, not just their health needs, but every other need, is including their social and behavioral health needs. And so throughout that patient journey process on each day, we're ready for that handoff to make sure that the patient gets everything that they need so when they walk out their door, they're better than when they came in. For patients that are navigating the complex healthcare system and their healthcare plan, their research matters. There is no question that's irrelevant. Every question is important and matters. It matters to you, it matters to your doctor. So when you're coming to your healthcare visits, it's important that you write down every question and concern and make sure that's addressed before you leave the office. Not just that, particularly at our office, we have resource managers that can help you navigate the healthcare plan, whether that's a question about prescription drug coverage or specialist coverage. You can have all those questions answered before you leave. And quite honestly, doctors want to know what your questions are, and in the process, we'll become better learners by learning from you. Over the next 5 or 10 years, the future of medicine will likely move towards a more value-based care model where doctors are more invested and involved in patients' care. As we know, there's not a one-size-fits-all approach to a patient's care. It will become more about disease prevention and proactively treating diseases or any illnesses that may arise. Wellness planning and a multidisciplinary approach to patient care will also be seen within the next several years or so as well. Sure. For me, my passion projects involve linking faith and medicine. What we know is those two things aren't necessarily mutually exclusive, but feed into one another. Those who have a strong faith and belief regarding their relationships and their health can also be invested in their own health care. What we know is that prevention and really establishing relationships with doctors and healthcare members are important. So for me, really creating an awareness that faith and science really go hand in hand. And when you believe for the best for your family, for your community, you also believe the best for your own health care and the health care of those around you. As an African American physician, the experience has been multifold. On one hand, patients do like to see physicians that look like themselves, but quite honestly, they'll like any physician that they see that delivers great care. And what I've learned from that is not only has it allowed me to care for patients that look like myself, but it allowed me to care for patients that do not look like me, and maybe tearing down some stereotypes and barriers as I care for patients of all different demographics and backgrounds. And really being an African American physician and learning that the healthcare community is growing, becoming diversified, and just being a part of that is a great joy and encourages me to really think of others beyond myself, as well as the patients that I see every day, whether they look like me or not.